Good afternoon. My case is an optic nerve aplasia in a myopic eye, which is a very rare developmental anomaly. It comprises unilateral or bilateral congenital absence of optic nerve, central retinal vessels, and retinal ganglion cells. Unilateral cases is associated with other ophthalmic abnormalities like microcornea, microphthalmus, and cataract, but the bilateral ones are commonly associated with the intracranial abnormalities. Optic nerve aplasia appears to be a part of a malformation complex that is inherently different from the optic nerve hypoplasia. However, numerous case reports in the ophthalmic literature mistakenly identify aplasia, describing it as instead hypoplasia of the optic nerve. To our knowledge, the largest series of the optic nerve aplasia was reported by Wheeler et al., who documented 11 unilateral cases of optic nerve aplasia and 2 atypical bilateral cases. I present a case report of a 6-year-old girl who was born to a non-consanguineous marriage, presented with complaints of inward deviation and diminution of vision in the right eye since 1 year. She had a full-term cesarean delivery and immunized up to date with no development delay. She had an 8-year-old brother with no similar complaints. On examination, it revealed absence of perception of light with mild ptosis in the right eye. The right eye had 50% diopters of esotropia with modified flimsy with overaction of inferior optic muscles. There was also microcornea in the right eye with corneal diameter measuring of 7.6 mm horizontally and 9 mm vertically. There was total afferent pupillary defect was seen in the right eye. The left eye had vision of 6/6 with normal clinical findings. Fundus of the right eye showed an avascular whitish area present at the presumed optic dislocation. There was no retinal vessel seen. Diffuse area of pigment epithelial atrophy and macular atrophy was seen with bearing of large choroidal vessel C. Fundus of the left eye was normal. Ultrasound B scan of the right eye showed absence of optic nerve shadow with an axial length of right eye of 24.6 mm, while that of left eye was 22.45 mm. MRI of the right eye showed absence of intraorbital and intracranial part of the right optic nerve, while the left eye had a normal optic nerve. Also in the coronal section we can see there is absence of right optic nerve. So this case summarizes the main features of aplasia of the optic nerve. Optic nerve aplasia is a rare congenital malformation that is usually associated with microphthalmus as well as with other ocular and extraocular anomalies. It likely arises from gestation insult during disrupting the retinal development and angiogenesis, leading to retinal ganglion cell degeneration. The exact cause remains elusive, although it was first described 160 years ago. There are different theories that has been proposed, like failure in mesodermal element, failure in fetal fissure formation, failure of ganglion cell development of mesodermal induction. On histopathology, it reveals a vestigial dural sheath and retinal dysplasia. There has some been role of external factors like episode of viral infection in first trimester or smoking during pregnancy. PAX6 and OTX2 genes might be involved, but the genetic basis remains unclear. The choroidal vasculature appears to be normal in optic nerve aplasia, but there is lifelong risk for choroidal neovascularization. Unilateral cases presents with normal brain development, but the bilateral cases may co-occur with hormonal like congenital hypopituitarism and structural brain abnormalities like Demoshire syndrome. Esotropia, anophthalmus, microcornea and other ocular findings are more frequent with unilateral cases. Prognosis of vision is poor, with management focusing on identifying systemic issues and supporting the patient with low vision aids, prosthetics and rehabilitation. So to conclude, given the potential for associated cranial nervous system and endocrine issues in children with optic nerve aplasia, a comprehensive systemic workup including neuroimaging is warranted to ensure complete evaluation. Optic nerve hypoplasia has been reported to be associated with myopia, but this case highlights myopia associated with aplasia, indicating a possible connection between retinal signals transmitted to the central nervous system and the feedback loop regulating ocular axial length.
I have no questions.
In literature, you reported there is how many cases could you get?
Ma'am, hypoplasia has been reported, but optic nerve aplasia as such has been reported very less. There has been a publication in the Indian Journal of Ophthalmology also. There has been 2 papers in Iran and Egypt, and one has been done, I think, I don't remember, in US, but not much. But hypoplasia has been reported in 11 studies.
It's very common.
Very common.
Very common thing.
This thing was, we were more concerned because one of the eye was showing an axial length, but means it was going more towards the myopic side. We tried to rule out any brain abnormality, any endocrine issues. There was nothing else associated with it. But the patient had an axial length more than that of the left eye. But it has been reported with hypoplasia, I mean myopia. but not with aplasia as such.